Well, your smile says a lot about you. It can convey confidence, happiness, and good health. But if you're self-conscious about your teeth or your mouth, you may not be smiling much at all. That's
right. The doctors at Carolina's Center for Oral and Facial Surgery can help with something called dental implants. Welcome this morning, Dr. Dale Misiek and Dr. John Wessel with Carolina's Center for Oral and Facial Surgery. Good morning to both of you. Thanks so much for being here.
Well, thank you for having us. We really appreciate that.
Of course. Dr. Misiek, let's start with you. First off, what are dental implants and who can benefit from them?
Well, a dental implant is basically a titanium screw that's placed into the jawbone that will replace the root of the tooth that supports the crown or the cap of the tooth. There are a lot of reasons why people may need to have dental implants. They may have decay, they may have gum disease, they may have trauma or even tumors. But regardless of the reason, it's very clear that dental implants can help and usually do restore the function that is lost when you lose a tooth.
So, Dr. Wessel, what would happen if you don't replace your tooth?
So there's a lot of functional problems with a missing tooth. First is there's less chewing surface. And in fact, if you lose a single tooth, you functionally lose two teeth because now there's nothing to chew against.
Oh, that makes sense.
Yeah, makes sense.
There can be some speech problems that develop with missing teeth. The adjacent teeth can shift or tip into the new position, which may make it difficult to restore at a later date. There's changes in the level of the bone in terms of height and width. And lastly, patients may be very self-conscious because they may not want to smile missing a front tooth in the aesthetic zone. And I've had patients who stay out of social events and just kind of become a recluse almost because they're very unhappy with the way they appear.
It's the truth, and a lot of times people don't think about that. I knew somebody very well who was very self-conscious about her teeth, and she did just that. She wouldn't go to parties, she wouldn't smile, she would cover her mouth with her hand.
Very common.
And when she fixed her teeth, it was a world of difference. It was like she became this new person. What's involved with a dental implant placement?
Well, initially after the consultation, we always will be in contact with the referring dentist to make sure that all of the planning and ultimate follow-through with crowns is done. A simple implant may take as little as 30 minutes in the office. It can be done under local anesthesia, or it can be done under IV sedation or general anesthesia, depending on the complexity of the case. A dental implant will require a certain length of time to actually integrate or fuse to the bone before it can be restored. And after the restoration, you'll be sent back to your dentist for them to place the crown or bridge or the support of a denture that may not be well fitting.
So you mentioned 30 minutes, Dr. Wessel. I'm thinking of bone grafts. Is that something also that you do with your implants too? And is that a tough procedure, easy procedure, what?
It really depends on the case. I mean, the bottom line is we don't do it all the time. It's a case-by-case basis. So bone grafts are necessary when we need to regenerate or regrow bone for a variety of reasons. That can be periodontal disease, it can be trauma, tumors, it can be if you've been missing a tooth for a long period of time, the bone will atrophy. And we have a variety of techniques available to us to regrow bone. The bottom line is you want to have enough bone to place the right size implant for the job. You don't want to put a small implant where it needs the function and support of a larger implant. And you need bone grafting to get there, and that's what we specialize in.
Where do you get the bone?
Well, there's been a lot of advances in bone grafting over the years. Traditionally, the gold standard has been to harvest bone from the hip or lower leg, but as you can see, you've got an extra donor site with the associated pain, recovery time, and potential complications. More recently, what we're dealing with are newer intraoral techniques where we harvest bone from one place in the mouth and place it in another. We can actually use bank bone, which can actually allow us to use bone that's not harvested from you. And we also have genetically engineered proteins that will actually stimulate stem cells in your body to recruit and actually change into bone-forming cells and grow bone there. There are constantly new techniques and new procedures that are being developed and researched.
It sounds like science fiction, but their office is on the cutting edge of technology. If you've ever considered replacing missing teeth or you're interested in dental implants, call the Carolinas Center for Oral and Facial Surgery. They're offering a complimentary consultation now through the end of October. The number is 704-347-3888. 3900. It's on your screen, 704-347-3900. You can also visit their website. It's mycenters.com, mycenters.com. They have an incredible team of doctors there. Thank you so much for coming. Really?
Cutting edge, no doubt.
Thank you so much for having me.
It sounded very fancy and sophisticated.
I know.
I was like, wow, that's pretty cool. Thank you for coming today.
Yes,
Great to see you.
You're quite welcome.
All right, still ahead on Charlotte Today this morning. A hairstylist shows us how to blow dry and style your hair at home so it looks like you just stepped out of a salon.
But first, increase your chance of landing that job or getting that promotion with the help of our next guest. Tips for maximizing your image and increasing your marketability.